We're starting, first of all, by showing you some lovely images of Abu Dhabi, because lots of people get Abu Dhabi muddled up with the other Emirates, especially Dubai. So we was just telling Sue earlier that when you go out into the rural area, you will see farmers going across the road with camels, and it's just such a spectacular sight to see, especially a Londoner, because this is not our norm. And also the Sheikh Zayed Mosque is unbelievable in any time, day or night, but night is just got that extra special time because of the lighting. And then the Formula One, the lighting around that is amazing. So if anybody comes to Abu Dhabi, you must come and see these sites. It's much more traditional as well, isn't it, compared to like Dubai?
Yeah, so we'll be giving you a bit more in-depth talk around the geographical location in a minute. But I guess the big question is, what brings two midwives to work in Abu Dhabi? Why do we choose to work here? And as you can see from this picture, this is the first time that we met each other via Zoom.
Yeah.
So this is a really kind of exciting moment for us when we realized that we were going to be actually working together. I'm back in Ireland and Gina's here in the UAE, and you can see in her face, she's like, yes, I've got another midwife that's going to be joining me. So we're just both really excited to get this opportunity. And I guess for me, it's always been a thing that I've seen that academic midwives, nurses and midwives have travelled and have broadened their horizons. There's certainly a big Irish diaspora across the globe wherever you go. And some of my midwifery lecturers, Rona, who worked in Alain, and Professor Geraldine McCarthy, many different academic midwives before me have gone to the Middle East. And I certainly would have held them as role models. So it would have been something that appealed to me always. And then I have to say that my sister lived here for 10 years, and one of my best friends lived in Ras Al Khaimah as well. So I'm backwards and forwards to the Middle East for the last 10 years. And previous to this, I worked in Bahrain, which is another Gulf country, for 2 years in the Royal College of Surgeons. Just before I came out here as well, and then Cardiff, and then back to the UAE. So I'm really happy to have the opportunity to join Gina,
and for me, my husband's been working here for 12 years as academic, and for 10 of those years I've been going backwards and forwards having a job in the UK. And then COVID hit, and then I found myself here in Abu Dhabi teaching UK students at first online. And then I started to feel that I wanted to stay here, wanted to stay with my husband. And I was really lucky that a job came up. And it was my really good colleague, Kenda Crozier, said, Gina, did you know that there's a job going on at Fatima College? So she's always got international knowledge. So she was fabulous. And yes, why wouldn't we go for this? It's a massive challenge, but it's a fantastic challenge to actually start a degree course in the UAE. So first of all, then, we just want to have a map just to show where the Emirates is, because sometimes people do get confused. So this map isn't absolutely perfect, but if you look where the arrow is, there's like a little horn that comes up in this area, and that is where the UAE is.
Okay, so the United Arab Emirates consists of 7 emirates actually. So the 7 emirates in the UAE, and in 1971 there was actually 6, but in 1972 Ras Al Khaimah then joined the Emirates. So I'm just going to name them: Abu Dhabi, Dubai, Sharjah, Ajman, Al Quwain, and Fujairah, and then Ras Al Khaimah, so RAK. So that's the 7 emirates that make up the United Arab Emirates. And okay, so just to give you some background as to the healthcare in the United Arab Emirates, we've both been here I've been here 6 months, Gina's been here for 8 months. So we've been like detectives trying to do our research and trying to read up all the documents that we can possibly find relating to healthcare in the United Arab Emirates. And what we can see is that there's been a rapid growth and development, which is consistent with our perceptions, I guess, of the United Arab Emirates. If you think of it, of Dubai, Abu Dhabi, United Arab Emirates, you think of like high pace, rapid development. It seems to be a very, a place that's full of growth. And this was certainly what we found in the literature. So we looked at literature and we found this beautiful oral history, which was taken by researchers in Ras Al Khaimah, actually, who interviewed local medics to talk about medicine and healthcare in the United Arab Emirates. So the first hospital was actually established in Dubai and Al Ras in 1943, and that was established by British colonizers there. In 1960, the Oasis Hospital in Al Ain was founded, and that was specialising in women's and neonatal health, and that is still in existence to date. So that is a very large maternity hospital here in the United Arab Emirates in Al Ain. The Ministry of Health was only founded in the 1970s, when the nation was actually founded in 1971. So over the last 50 years, we have seen the establishment of healthcare in the UAE. Abu Dhabi government set up the General Authority of Health Services for the Emirate of Abu Dhabi in the 2000s and 2001. And Fatima College, where we're currently working, was founded in 2006. So Fatima College is a college which is only for women, and it was founded by the mother of our nation, who is Sheikha Fatima. And her vision is that to promote Emirati women working in healthcare professions. And there's 4 campuses across the Emirates in Abu Dhabi, Al Ain, Al Dhafra, and Ajman. There's 3,000 students across 4 campuses, and we produce over 1,000 graduate nurses in the UAE every year. So it's quite a significant proportion of the nurses in the UAE would come from Fatima College. We have 6 accredited undergraduate degrees, including nursing, psychology, physiotherapy, medical imaging, paramedics, and physiotherapy. And we're currently obviously working on developing an accredited midwifery program. So it's really, really exciting. And it really is being supported 100% by our team, who have started developing this little acorn was sown long before we've arrived. Yeah. So we definitely have to acknowledge all of the team that have come before us. Annie and Dr. Gleeson have really they've really driven forward this agenda for women's health, and they really want to make this midwifery program a success. So Fatima College was established in 2006. And you can see on the timeline in 2007, there was a restructuring of the Department of Health by Sheikh Mohammed bin Rashid Al Maktoum. And then in the 2010s, 2012s, there's been much more development as well. The most recent thing would be the transition in Abu Dhabi to the Department of Health. So we have our own Department of Health here in Abu Dhabi. We have to talk about the UAE NMC, who are our nursing midwifery regulator. They were founded in 2009, and they would regulate nursing midwifery across the United Arab Emirates. So I guess in terms of, just to give some background about the health improvements in maternal care, we have seen the United Arab Emirates go from somewhere that was, I suppose, desert essentially, to now being a modern, high-tech, developed country with swift and rapid and impressive improved outcomes in line with the Millennium Development Goals and SDGs. And I guess that's something that we would like to keep pushing forward with especially the advancements and the most recent reports, like the State of the World's Midwifery in 2021, which has urgently called for more midwives to address the agenda for universal healthcare coverage and the SDGs. So it's really, really crucial part of the global priorities, and the United Arab Emirates government are recognising this. So the kinds of developments, just to put it into statistics, I guess, this is a really powerful statistic. So I want you to just listen to this. In the UAE in the 1960s, approximately half of newborn babies did not survive, and a third of mothers died during childbirth. So that would be within living memory, I would think, of the current generation. So I'll repeat it. Approximately half of newborn babies did not survive, and a third of mothers died during childbirth in the 1960s. It's very recent. However, now our infant mortality rate fell to 22 per thousand live births in 1990 and falling further again in 2011 to 7 per thousand. And most recently in 2015, mortality rate was 5.6 per 1,000. So from 22 per thousand to 5.6 per thousand. So they have made rapid strides and impressive changes and improvements in maternal outcomes and neonatal outcomes.
And just to think about other risk factors as well in health generally, there are issues about obesity. 27.8% of the population is said to be obese. There's also problems with smoking. 1 in 8 deaths are said to be associated with smoking, and this is males. Cardiovascular diseases is high on the list for causing deaths. 2/3 of deaths is because of cardiovascular problems. And strokes are the 3rd greatest cause of deaths. Cancer, 15% are caused by cancer. Diabetes is widespread as well. But what we have seen going around the hospitals, that all these health issues, everybody knows about them. I mean, the students know about them too, and they are being targeted by the key performance standards, the KPIs as well. So they're really on it. And they are there's a massive push to increase the number of nurses and physicians as well. So they do see that they haven't got enough, and they're trying to make increases internationally and locally as well. In the hospitals, all the documentation is going electronic. So some of the media is mixed at the moment, but some have gone totally electronic.
I guess I just wanted to say as well about the UAE national policy. So they are recognising that there's an increased population growth, and in line with that, that we would need more healthcare staff to facilitate the increasing births. But a crucial thing here is that we need skilled Emiratis because of recruitment and retention, because with a high staff rate of expats, there's a high turnover, and we really want to promote growth within the Emirati population, so that there will be longevity of staff. Okay, sorry.
And here we just wanted to give you an illustration about what Maeve was saying earlier, that there's been so much structural change. And this photograph was taken in 1964, and it just shows the rapid development in the UAE. Here's a picture of Casa Al Hosn, which was the original home of the ruling family of Abu Dhabi. And you can see in the background that there's palm frond houses and Bedouin tents, and they are the black tents that you see. And then you see that in 1960s, late 1960s to 1970s, this is the same site with Casa Al Hosn. And now you see structured roads and motorways, and you actually see concrete houses as well. So look at this development, look how quick it's happening. And then in red, illustrations, I have to say, from my husband. He has shown that this is Casa Al Hosn, and look at the development now. This photograph was taken in 2013, and you can see the skyline has completely changed.
It's beautiful. I was there recently for a festival, and it's just beautiful. It's in the middle of the city, so they still preserve the fort in the exact way that it was. They've done a really nice job there.
Beautiful. And like you said, Maeve, this has all happened in about 50 years. This is astonishing, the technology, that how it's advanced.
Okay. So let's get to the business at hand, midwifery, what we're all here for. Okay. So this is one of the main challenges that we face in global midwifery today. If we look worldwide, when we're looking at developing midwifery, the first challenge that we face is actually identifying what is midwifery, because worldwide we know that nurses are often conflated with midwives. And the ICM have kindly given us this lovely definition and a lovely explanation for for us to put into words exactly what it is that we do. So we have a particular approach to care of women and their newborn infants, whereby we optimize normal biological, psychological, social and cultural processes of childbirth and the early life of the newborn. And we work together in a particular way with women in which we respect their individual rights, circumstances, and we take their views into consideration when we're working with them to make decisions around their care. We promote self-care in women to empower them, to give them ownership of their birth and to promote their own abilities to care for themselves and their families. And we provide respectful care with dignity. We collaborate with other midwives and other health professionals. So the key there is that we recognize the abnormal. We're very familiar with the normal processes, and then recognizing when things become abnormal and escalating to the appropriate healthcare professionals. So yesterday, with the International Day of Women's Day, I saw the ICM put out some really good graphics, and one of the graphics that hit me was they put out some of the outcomes that midwifery affects, and one of the key outcomes that they posted yesterday was alloimmunization. So the Lancet Midwifery series, there's 4 papers which were published in 2014, and the paper by Petra ten Hoop-Bender, it gives you all of the outcomes that are improved by midwifery. And just to think that by knowing the normal physiological processes, that midwives can actually identify the abnormal and escalate, something like alloimmunization can be prevented, that really struck me as a powerful outcome, which is tangible when we know that that midwives can improve maternal and newborn health.
So where did we have to start? So it's a big task. So the first thing that came to mind is, what does midwifery look like in the UAE? We didn't know where midwives were working. We didn't know what scope of practice they were working, and we didn't know how they felt about their working conditions. So that was our first question that we had. And then we also thought that we needed to get the perspective, obviously, of service users. We want to know what's the experience of women. But our questions slightly changed. And when we tell you about our experiences of going around the hospitals, we'll let you know that. But our questions changed for the women, because first of all, we wanted to ask the women, who was looking after you? Did a midwife look after you in the antenatal clinic? Did they do your checks? Did they look after you in labor? And then what we found by going to the managers and the midwives in the hospitals, that actually most of the midwives were working in the labor ward and not in the antenatal area. So I'll go in a little bit more detail on that in a minute. So we didn't need that information from the women. What we actually needed from the women then was, how would you feel about a midwife looking after you? Because it's a change, isn't it? Because in much of their care, they're actually having obstetricians caring for them antenatally. And in the postnatal care, they're having maternity nurses, and they're doing a fantastic job. But where does midwifery fit in this? And we have to find out if the woman is willing to change that setup of care as well. And also the obstetricians, they're going to have to help support our students. Because if they're doing all the antenatal care, then the students are going to have to align with them and be taught how to do antenatal abdominal palpations and all the check from them. So far, the obstetricians are being really supportive, and they want midwifery to come through. But it is going to be a challenge for the whole team, because it's going to be massive changes of dynamics in their working conditions. And in the future, as the cohorts evolve, we will be getting student midwives feedback. But what we are getting from student nurses is, when are we going to start this course? When are you going to do midwifery? So it's looking good. Most midwives nurses are asking us about a bridging program, isn't it? But I think at the moment we're concentrating on the degree program, and then the next in line would be to do a postgraduate. So that's what we're going to be offering. So just to give you a little bit more information about, we'll go on to the MATE tool. Yes. When we was going round to the stakeholders, we had our MATE tool in our hand. And what the MATE tool enabled us to do was to assess our curriculum, our organisation, our education organisation at Fatima College, but also to ask questions about the facilities that are available at each hospital. Who are their staff? You know, what equipment have they got? How many rooms have they got? How many berths do they have? And like I said, what we found was that midwives were mostly working in labour wards, and that wasn't a choice. That wasn't even a choice of the organisation. They just haven't got enough midwives. So they're centering them where they think that that is the priority, where that's the safest place from a woman's perspective for them to be. And that's why obstetricians are doing the antenatal care, but midwives are doing health promotion, aren't they? They're doing the antenatal classes, and they give health promotion information to them. And then postnatally, the maternity nurses are looking after the women. Now, women are in hospital for approximately 2 to 5 days, depending on the type of birth. They stay in a little bit longer than what we're used to, because when they go home, they don't have community visits. If they have a problem, they would go to an obstetrician if it's about themselves, go to a pediatrician if it's about the baby, or a lactation officer if it's about the breastfeeding. So they go to as an outpatient. And we're hoping in the future, because the director of the hospitals have been really good about wanting to support community care, because we know community care does happen in nursing, doesn't it?
Yeah.
So we're hoping that we'll be able to follow suit and get midwifery into the homes, even if it starts with the postnatal. Is there anything else that you would add, Maeve?
No, just the enthusiasm really, and the drive and the will is there definitely. And like we said, the students are very keen to join us, and everybody wants to know when we're starting.
Yeah.
And I think it will be very exciting if we can get the accreditation. So let's get on with the next bit. So I guess the next thing that we're going to talk about is, obviously, in order to have competent midwives and build the workforce, we need to have a high quality midwifery education and degree available. So we need to have high quality midwifery education, which will underpin all of this to give us a really strong midwifery workforce, hopefully going forward in the future. So myself and Dr. Gina have been tasked with developing a midwifery curriculum. And our current business in hand is going through accreditation, and we have 61 points of feedback and requirements that we need to work on. So we are basing our new curriculum on the ICM competencies, which are freely available, and it's a fantastic facility that is there from the International Confederation of Midwives. Everything is there for any country who is interested in developing midwifery. All of these resources are available online. So we have these competencies which are essential for midwifery practice, and they are forming the basis for our curriculum. So we have general competencies, pre-pregnancy and antenatal, care during labour and birth, and then the ongoing care of women and newborns. So that is our basic sort of competencies and standards for our foundation, our program. We're just highlighting there, I guess, the outcomes. I talked about them, I touched on them briefly earlier. The Lancet series has highlighted the kinds of outcomes that we can expect when we introduce midwifery to the UAE. So you can see the many different outcomes that are improved when we introduce high quality midwifery education and midwifery to a country. So there's many different benefits for public health and for maternal and newborn outcomes, which are there on the screen. In terms of our program, we are going to be incorporating the Baby Friendly Hospital Initiative standards, and we will be doing a 4-year bachelor midwifery program. So the first year will be a foundation year, which will be like a general requirement year. We follow the American system of education, where the students select their courses and it makes up a certain requirement of hours. And so we're following that American system.
Yeah, but we're also piloting, aren't we? Because we're doing a block system so that they will have their theory and skills and then go out into clinicals, where at the moment they're doing
a blended system. So yeah, at the moment they do 2 days of clinical per week, and then they have theory and lab in the same week. Whereas we are going to do like the UK system, where we have 8 weeks of clinical or theory and then clinical, similar to what we would be used to.
But we were doing it because of the stakeholder meetings, because the staff in the hospitals have said, please Let the midwives do a block system. Let them come here and do 4 weeks at least as a block so that they can really enhance their skills. So, yeah.
So for first year, they'll do their general requirement. We're doing a course called Introduction to Nursing and Midwifery, where I'm going to lead it, and it's going to be about talking about the history of nursing, the history of midwifery, and really be doing some self-development work and coaching for each student to work out what it is that they would like to do. And then we will have interviews for the students who would be interested in midwifery, and myself and Dr. Gina will assess which 30 students out of how many?
I don't know how. Yeah, I don't know how many.
How many? But it could be hundreds.
Yeah, we're going to choose.
Could be hundreds might apply. We don't know yet. Hopefully there'll be lots apply. But we will be selecting 30 students for the first cohort who would hopefully start into second year in August 2022. All going well, fingers crossed. So second year then will focus on their normality, the normal physiological processes, and then from third year we'll move into the complexities, and fourth year is building competency and consolidated practice as per kind of the normal midwifery curriculum.
Absolutely.
Is there anything else you want to add here?
No, I think that's superb.
Okay.
And our curriculum is based on health promotion, how midwives or the student midwives will be trying to promote health, and then enhancing the physiology and recognizing that as their scope of practice. And when they need to do a first line management to bring in a situation to bring it back to the normal physiology. And if that doesn't happen and there's more complexities, then they need to have a knowledge of the multidisciplinary team to refer. So everything is following that format throughout.
Okay, so I suppose just this slide here is kind of focusing on the fact that we need midwifery more than ever. We've reiterated this throughout our whole presentation. We need midwives, and we really can make a difference if we are given the opportunity to produce more midwives and to work in our full scope of practice. And I guess that is the key thing, really, is that, you know, we could be sort of doing the same thing that's always been done, but we have to be brave, we have to have courage, we have to have conviction in our abilities as midwives, and to give our students that courage to sort of work in their full autonomous scope of practice, recognizing their capabilities as midwives, and making sure our job as midwifery educators is to make sure that all of these students graduate confident and competent and fully skilled and ready to take on the challenges of leading the next generation of midwives in the United Arab Emirates. We have every confidence in these students. We do.
And so that would mean that actually these midwives will be doing the antenatal clinics. They will be, and they will be doing postnatal care, you know, in the future, and they will be doing community care. That is what they're going to be taught, that they're going to be ready to use their full scope of practice.
So so they will be using all of these full scope of practice as per the framework in the QMNC.
So this is us, because at the same time of doing the curriculum, and Maeve loves the whiteboard. It's our thinking time when we're together. But in the meantime, we're also teaching, and we love it, teaching the maternity nurses, don't we? Because at least we feel there's a connection there with midwifery. So we teach theory, we teach the skills, and we also go out in the clinicals. Now, the great thing about the clinical area is, as lecturers, we go out with the students as well. So we're not allowed to do any hands-on care, but we're there to just enhance making that connection between the theory and the practice. And that has been a real delight. And we're hoping we can use that when the students are student midwives in the future are with the obstetricians, for example, we can then explain and translate the philosophy of midwifery in practice while it's happening as well. And we've seen such good things on our way round on our stakeholder meeting. And one of them was seeing this pool, because obviously if you're going to enhance the normal physiology, you need an enabling environment. So this is part of our task, is looking at the environment and thinking, okay, in their second year now, how are they going to get this experience? So we was delighted to see this pool, and we know that there's other pools, water birth pools, and we just need staff to be educated so that they can use them. So staff are excited to do that in the future. The facilities are fantastic in the hospitals, aren't they? You've got single rooms for every single postnatal woman. You've got spacious rooms for the labour wards, and they're bright, natural daylight with beautiful views of the desert in most areas. And there's that privacy as well, isn't there, in the rooms? And the midwives, I have to say, they're really motivated and they're passionate. And it's just lovely that we are just all the same, aren't we? Wherever we are in the world, we've just still got that passion.
Yeah, I think it's just been really inspiring, really, to meet these midwives, and you have that connection. And I found that no matter where you go in the world, when you're a nurse, when you're a midwife, you have this simpatico, you have this understanding, and you immediately understand the common challenges and also the joys of the job as well. We really have had a great time sort of getting to know these midwives and talking about births and things that happen on their day-to-day rounds and everything like that. So it's been really interesting, and to hear the kind of cultural norms as well around births and learning many different things. So it's just been really, really a privilege to be invited in and to be welcomed the way we have as well.
So we just know that the environment is there. We just need the student midwives in that environment now. Okay, so challenges. I think the biggest challenge will be the changes that come up, isn't it? So everybody's very supportive at the moment, but it is going to be a challenge. It's going to be changes. You know, if the midwives are going to be doing antenatal clinics, that in itself is going to be a massive change.
Yeah, I think this is something we're both, I think I said this to you at the beginning, Sue, that we're under no illusion that this is we're here for the long haul. This is not going to happen overnight. This is not something that we think is going to happen in the next year, in the next 6 months. This is a long-term kind of plan that we both are committed to. So hopefully, you know, by 4 or 5 years, we should start to see a couple of graduates come through. And then in the next 5 to 10 years, we would kind of see the results of this coming through. Yeah. We have met some of the graduates from the 2010 cohort. Yes. There was a midwifery program that ran, and we met some of those midwives who are just fabulous. Yeah. They're working in leadership roles at the moment. And I guess, so we're familiarizing ourselves through the scoping exercise and through all of the stakeholder meetings. We're familiarizing ourselves with the kinds of challenges that might crop up. But we're both capable, we're both here, we're both positive and motivated, and we've definitely got the right environment and the right sort of support behind us. So we're both very positive about it. I think that there is, like I said, that drive here. When we have that will to change something, things tend to happen quite quickly. So this change might equally come from the women. And I think that tends to happen a lot with grassroots things, is that suddenly women want change, and the women will ask, well, I want to have a water birth. I want to have a midwife-led option. And we're seeing those kinds of inklings. We're having people reach out to us, and there is a lot of, like I said, motivation to have these midwife graduates and to employ them and to give them opportunities to work. So we're very positive, we're optimistic.
And we've got research going as well. So we was really happy when we passed the first ethics committee, didn't we? So we've got research going around the midwives, just to ask them where they're working, just to get a bigger scope, just to find out what they're actually doing. And then we're going through the ethics at the moment, so that we can do a survey for women as well, just like I said, just to find out how they feel about midwives looking after them. So we just wanted to say some thank yous, because you never do a project on your own. And when you've just got such a big task, you just don't know where to start. So we was just so lucky that we was able to reach out and look at this. I mean, it's global. So Dr. Kenda Crozier from the University of East Anglia was speaking to us. All these specialists were speaking to us about the curriculum. Astrid Francis from Chile as well spoke to us from a university there in Santiago. And then Indy Carr, she has been really brilliant, because not only does she have the knowledge of the curriculum, but she's been in our position when there was nothing. So she has given us so much insight, hasn't she, about Fernandez Hospital Foundation. And then Samuel Abdu, who we met at Fatima College, because Fatima College is giving guidance to Jimma University in Ethiopia. And so they were coming over and observing our practice and learning about our curriculum, but obviously it's an exchange. And this young man is in his 20s, early 20s, got a master's, super intelligent, and doing such brilliant work in Ethiopia. And they shared their curriculum on midwifery with us. So it's been absolutely wonderful. And then Lindsay Gilman from Kingston University as well, because we're praying that we'll be able to use the Mora. Can you believe it? But we're going to call it something else, because we're not going to use the NMC standards, because we're here in Abu Dhabi. It doesn't match. So we are going to, that's why we're using the ICM competencies.
And then we just as well to acknowledge Corin Adnani. She's a colleague of mine from Indonesia. Yeah. She's a friend I've met through Twitter, and we've co-authored before, but her PhD was in the area of midwifery curriculum development in Indonesia. So we reached out to her, and she kindly shared so much support and love and information. So just I really like to share gratitude and acknowledgement to all of those people, to Indy and Kenda, Astrid, all of those people. And if we can't name anybody or name everybody, because we're going to leave somebody out.
Yeah,
so just thank you to everybody that we've spoken to about the midwifery curriculum. Thank you so much.
Oh, you'll have a few questions.
So where do we go from here? Not even us know. You know, we know what's going to happen tomorrow and what we're hoping is going to happen in August. But that's the great thing. That's the brilliant of this challenge. And that's what we're looking forward to. And that's what keeps the fire in our belly to succeed.
Yep. So let's see. Where are we going to go?
Yeah, Abu Dhabi style. Midwives on call in Abu Dhabi. This is what our dream is.
I love that. I love that. Thank you. Thank you so much to both of you.